And you like to talk about like common skin conditions that the artists should know about. And that's why it's so important for the young artists to study skin and learn what may or may not be contradictive to PMU.
Correct.
And that doesn't mean just because someone has some skin conditions going on, that does not necessarily make them not a good PMU candidate.
Right.
But maybe there's something that they have to address before and get cleared up, or just address beforehand, either on their own or with a doctor, before we move them into PMU.
Yeah.
And then maybe some things we can, we can work on them with whatever's
everybody deserves to have
on.
Beautiful brows, regardless of, a condition, right?
Right.
And so if it's something, now we're not doctors, right? Unless you're a doctor, we don't diagnose. But this is why I don't feel like every PMU artist should go out and become an esthetician if they're not already one. There are many PMU artists that are estheticians and cosmetologists. But if you're not, at the very least, train, learn about the common skin conditions that are, like I said, common, like acne, like sebaceous hyperplasia, like, actinic keratosis. There's just a handful, maybe 10.
Right.
And actually, that's what my second book is about. It's called In the Skin. It's about educating the PMU artist about the skin canvas in front of them. And it's not about becoming an esthetician. It's about learning about the canvas. For example, because I hang out on a lot of those Facebook groups, right? A lot of the PMU groups, and you really learn. I love to kind of give back and empower other artists. And I see so many artists like turning away clients because they have, something. And I say, gosh, I'm not diagnosing, but it looks like, seborrheic dermatitis or something that is just common, that a simple visit to their dermatologist can, cure. And these are chronic conditions that can be managed, but are not contraindications to PMU.
Right.
So again, let's not deny the client a beautiful brow just because they have a flare up and they may not be aware. The flaky brow I see, so, that's so common.
Right.
And so that's, it's just like, basically dandruff. It's fungal related, and their dermatologist may prescribe Neutrogena T-gel that's used for dandruff over the counter. But again, we don't diagnose. We just give our professional recommendation. But I see that all the time. And so many times, PMU artists will turn these folks away, and that's not fair. Everybody deserves beautiful brows.
Yeah. I think it's knowing when to, when to be able to identify something going on with the skin.
Yep.
And when we can work on them in that moment and safely and still get them to a beautiful result, and then knowing when to not work on them in that moment and advise them to go see a doctor.
Right.
But then this brings up a whole new subject, Rose. What about, so let's say someone comes in and, there's something icy going on the skin, and it could be a raised something. It could be just something that's making me a little nervous, a little uncomfortable. Maybe I don't really know what it is. Some things I recognize as well. I know exactly what it is. And maybe it's just going to be some moisturizing, something simple with a dermatologist, something that does not require a doctor's note, just something that we got to kind of get better managed before, and quite easy. But what if there is something we don't really know what that is, and it's making us very uncomfortable, and we want to keep the client safe, and we want them to go talk to their doctor. This is a topic that I see a lot. Should we require them to come back with a doctor's note? And does that doctor's note protect the PMU artist? Because a lot of doctors now are declining to write a note because they don't want the liability. They don't want, doctors don't want to sign a client off and say, yeah, you can go get your permanent makeup. And then, God forbid, something happens.
Right.
They get an infection or something. Not too much bad happens with PMU.
Right.
What's our worst case scenario? Infection. But it's not like
nothing we can't fix.
Nothing we can't fix. Nothing that can't clear up with maybe even an antibiotic. So we're kind of, especially when it comes to the brows. I think eyeliner is a whole different subject because we're dealing with eyeballs and sight and all that. But brows, we can always kind of come back from something
Yeah.
that's gone sideways, right?
100%.
But with that said, there's a lot of doctors out there nowadays that will not sign a client off. They will not write a note. So have you encountered that? And then what advice would you give to a PMU artist that's kind of in that situation? Client calls back, says, you know what, my doctor won't write a note. So will you still work on me?
Yeah. We live in a litigious society, no doubt. So I can see the doctor's perspective and that what their concern is. They don't want to get sued ultimately. But, you just kind of answered your the first question when you were talking about, gosh, I see something, I don't feel comfortable with it. I see that this is not, anything that's, life-threatening maybe, but it just doesn't feel right. Then pause right there and talk to the client about it. But before that, rewind a little. We all should have ironclad paperwork. The paperwork should be ironclad, and we should have like addendums and clauses. And at the very least, let's say a client comes to me, and no, I don't deal with that often, by the way. But if it did happen, and if I was not comfortable with it, I do deal with it more as an electrologist, because I'm an electrologist and I see a lot of underlying hormonal conditions, never diagnosed, but my trained eye, gosh, it looks like this may be PCOS, which is something that's a very common hormonal condition. But I will not treat the client with electrolysis unless they come back with a doctor's note or something proving that they're receiving treatment. And treatment could just be, I don't know, spironolactone or a birth control pill, nothing major. But my treatment won't be efficacious. Like, it won't work unless they're getting treated for their condition. So then it falls on me. Gosh, Rose sucks as an electrologist, but no, it's because you're not treating your underlying condition. So I would treat PMU the same way. Is, gosh, this is something that needs to be seen by a doctor. If they don't want to give you a note, fine, but just go see them, diagnose the condition or whatever it is. If they could at least give you a note stating what that condition is, they're not giving you a green light or anything. They're just saying, yes, this is, sebaceous hyperplasia, whatever it is, acne, cystic acne, whatever it is. And then, then we can go from there. The artist should have a general understanding of the skin. And at that point, if the artist chooses, follow your intuition. We don't have to work on any client we don't want to. But if the client is, gosh, please, I need beautiful brows. I want you. I trust you. I'll sign whatever. Make sure your paperwork is ironclad. Perhaps, have them sign an addendum or something. Consult with your insurance company if you're concerned about that, and say, gosh, will this hold water in the case of any, but again, nothing's going to happen. In a heartbeat, I would do it. But I would proceed really slowly with caution, maybe diluting the pigment, whatever that means. What does proceeding with caution means? It depends on the situation in front of me. But I wouldn't jump in the deep end with that procedure. I would just, go in very lightly, and then we could revisit anything in the future touch up.
Yeah, I agree with you. I think most clients, if not all, right, they don't want to do anything unsafe for themselves either. Right. And so, and most of them will have a conversation with their doctor if you tell them, look, I'm a little concerned about this. I'd like you to talk to your doctor. They'll at least have a conversation with their doctor. I've had so many clients that have. And I've had a handful of doctors not write them a note. So the client, came back in. My doctor won't write me a note due to liability reasons, but this is the conversation. This is what they told me it was. I got on this medication. And then I'll say, okay, let's do a little addendum. About, and on the addendum, the name of the client, the date, we write a little thing that they had, what I advised them of. They did talk to their doctor, the conversation between them and their doctor, and they've decided on their own, to move forward. And so, it's just like you said, dotting all your I's, crossing all your T's, and following your gut. If there was something I'm like, you know what, I am just not like a blood disorder. I mean, something.
Or I have, I don't know, a transplant. I'm on anti-rejection medication.
It's something really
like,
medical. You're talking, something really medical.
Chemo, cancer. I mean, I will not, unless I definitely for sure,
there's some things
black
you
and
just
white.
don't.
I need a note before I proceed. You have chemo, your immune system is compromised. They have diabetes. Their healing may be compromised. So there are certain things that we definitely do need a note for.
No, I understand. But I'm like you. I see a lot of, someone will post, a picture of a client and say, she has this, and this. Should I work on them? And a lot of people, no, I wouldn't work on her. I wouldn't work on her.
I see that all the time.
And
Like,
I'm sitting there going, I would totally work on
me
her.
too. Totally. Exactly.
So, but I think it's the society you live in. Like you said, we're in a litigious, it's either the, I think as young artists, you're scared.
Yeah.
You're nervous. You don't
And I
want to
get that.
Yeah. We have a lot of responsibility, and it's kind of like, I think PMU artists are in the same situation as doctors. Doctors, take that oath, I will do no harm. Same with PMU artists. I think we all
We should have an oath.
And I think most of us do.
Yeah.
Most are good people.
Innately,
most people
in our
the
mission
world are
statements,
good
yeah.
people. Yeah. And so we have this desire to do no harm.
Yeah,
And we're protective that way. We want to protect the client.
I think as long as we tell the client, listen, I have your best interest at heart. I can charge you $2,000 right now, whatever it is, but I care more about you than your business. Of course, I want your business. I have a business. I'm in business to make money. But at the end of the day, as long as they know that we have their best interests at heart, they will 100% appreciate it. I've never come across someone that has not, because I'm in South Florida where it's the Wild West for tattooing. People are doing procedures in their kitchen and BBL butt lifts in their basement. It's like all the things. And so I see a lot of, purple brows. Just today, I showed you a text that I got just today from a client that was referred by a doctor I work with, which is a great thing to do. Any artist listening right now that doesn't have a relationship with various doctors in your area, not only dermatologists, but endocrinologists, plastic surgeons, particularly laser removal, because in the state of Florida, you need to be a doctor to conduct laser pigment removal. And so sometimes, implants are so deep, it's beyond the boundaries of, wanting to use, a removal method like lift. Sometimes like today, I'm like, gosh, I'm not even going to tackle that for saline removal. I just need to refer her to this doctor that I work with. And she wants an immediate result because she doesn't like her purple brows. But I see that it's like a Sharpie.
But there is no
It's like 30 years
result.
of permanent makeup like packed in there.
Yeah.
And, again, I tell her straight up, or clients like her, because I see them all the time, is I want you to have a lifetime of beautiful brows.
Yeah.
I don't want to put a Band-Aid on your brows. A color correction, okay, yeah, it'll be fine for a few months.
Yeah.
And so they appreciate that at the end of the day. So,
Yeah.
and I'm losing out. I may not make money off her, but it's okay.
Yeah. Yeah, and there's no quick result, whether it's laser, whether it's saline.
Right.
The quickest result is a color correction.
Yeah.
That's what gets us to.
And that works many times. It depends on the brow.
And I'll tell you what, I do removal.
Yeah, of
I
course.
learned it
Yeah.
20 years ago from Mary Jane Hockey, Marjorie Grimm's. I've been doing it for years and years and years and years. But I also am really good at shifting, gray, purple, green, red, orange brows back to brown. I'm very good at it. I'm very efficient. And I think there is a little bit, I see a lot of this on the boards too. Like that picture you showed me, I would color correct that in a heartbeat.
I was just going to say, okay, I'll send her here.
Dollars to donuts. There's a 90% chance she'd never see that gray again ever.
We'll
me.
talk off.
Yeah. So I see a lot of removal, should I color correct or removal?
Yeah.
Color correct or removal. And so many people are pushing removal, whether it's laser or saline. And I'll look at it, I'll go, man, that's easily could be color corrected. And you probably won't see that old gray or the old purple again. There's a really good chance you won't. There's a chance you will in a couple of years. And then in a couple of years, you'll have to go, maybe a pass, with some warmth again, or with yellow, and then, target color again. But in my own work, in a lot of people's work that do both color correction and removal, a lot of us see long-term amazing results with just color correction. But there is a line.
Yeah,
There's a
100%.
line where you can kind of, where you have to know, okay, that's beyond color shifting. That's beyond color shifting. That is probably going to come back in less than a year. And now you're looking at having to redo a whole corrective process every single year or less. And that's not a good situation to put a client in.
Yeah.
So you do have to kind of weigh that. But
you see, I need to consult with you on that.
Yeah.
Again, I only know that I know nothing.
Yeah.
So
well, I look at saturation levels, and then I look for different things like shininess to the skin, saturation levels.
Right.
I look for certain things that are going to give me indicators whether I should put that client into a corrective using modifiers. And it's going to be, 80% chance it's going to be long-term successful. Then I go for it. And then, or with those indicators, is this client going to be better off in doing some removal sessions, because that is that client's best option for long-term results. I'm always about the long-term results.
Me too. Yeah.
And I'm really, so we have both correction methods using modifiers, and we have saline removal that are at the PMU artists, beck and call. We can do both. And then we have laser if you're a PMU artist that doesn't prefer saline or doesn't perform saline.
Yeah. This is why I think every PMU artist should be trained in saline removal.
Yeah, because we can control it. Because sometimes you don't even have to
can never
remove
make a mistake.
all of the brow. Maybe you just have to pull out 50% of the color to create new space.
Or even as we're working, if we did a little stroke or something, oh gosh, we could immediately remove it. It's so empowering.
Yeah, it's really empowering. It is really, really empowering.
Which is a whole other conversation.
Yeah, and especially for the corrective process for the clients, because sometimes I think maybe laser clinics or laser doctors, they might put them through more sessions than needed. If we're doing the saline, we really monitor that. We know how much can be removed and how much pigment can be remaining. And when it's time, okay, now there's enough. We've removed enough pigment. There's enough space in that skin now where we can start adding new pigment. And most likely you're going to have long-term results. We're going to get you back to that brown eyebrow with long-term results. Yeah. And I'll never have to color correct again. So so I think that's a really great, I love talking about that.
And to that point, and like I'm using I love my Tatter-a-fact mug, by the way. I love it. But this is the analogy that I use for eyebrows all the time that I give to clients, because they don't realize they come with these saturated eyebrows. Eyebrows are like a glass of water. There's only so much water that will fill into this glass, right? So it's particularly Miami, Wild West. 30 years of PMU, their glass is nearly full. Let's say it's 75% full. Yeah. I can add 25% more of the best quality pigments, amazing techniques, high quality needles, all my certificates on my wall, but it's still going to be upstaged by that 75% crap that's in there.
That's still in the skin.
So I need to pour out as much of that dirty water, if you will, so that I can, work on as clean a canvas as I can. There's a finite amount of space that'll fit on the brow. Right. A lot of new artists don't realize that.
No, a lot of new artists don't realize that. And I think that's why on, many skin types, I think it's really important that the pigment being used is pigment that will fade out of the skin. In a couple of years, you have organics versus, inorganics. Yep. And there's, certain skin types. Like I would never, and we have both. We make, we have aqua, which is, an inorganic mineral pigment. And we have loaded, which is a super strong, very long lasting,
very concentrated,
long lasting pigment. And, on someone that's really super ruddy, highly pink, sun damage, on those skin types where that skin type alone is at such a high propensity pulling gray. Yep. They're going to pull gray and heal pigment gray. Right. I would never use a long-lasting pigment on them, or I would never use an organic because organics alone, if an organic is going to shift color over time, it doesn't always, but if it's going to shift to the blues and grays. That's what organics tend to shift to.
Which are cool.
Right. Blue or gray. Right. And typically it's because of the carbon base. So, but like I said, I have a pair of dark eyebrows on my wife, and they're 6 years old and they've never shifted colors. So it is a myth. It's not accurate to say that all organics are going to shift to blue and green. That's inaccurate. It's not accurate to say all iron oxides or inorganics are going to shift to orange or red. That's inaccurate. Yeah. It's not accurate. But if an organic is going to shift on skin, it's going to shift to the cool side, the blues and grays. And if an inorganic is going to shift, it a lot of times, not always, it may shift to the warmer tones, but inorganics can certainly shift to the grays if you're using a super dark color with, So on skin that pulls gray, I'm not going to use a line or a type of pigment that has the propensity to shift to gray.
Right.
'Cause
Which,
right?
circling back to understanding your skin canvas.
Exactly.
Because you and I were talking about this earlier when you were showing me something you were working on. Ruddy skin, red skin, it's red. Let's say it fits to ruddy skin. Oh gosh, she's warm because she has pink and red skin, and the color pink and red are warm, right? You think of fire, and that is the coolest. I mean, she is gonna heal
gray,
completely ashy, right?
Yeah.
And so again, the artist really needs to understand the canvas.
Really needs to understand the canvas, and I think it's really important that artists understand and work with both iron oxides, inorganic pigments, and organics. Have both in your toolbox and know when to use each one. Both types of pigments are invaluable to the artist.
100%.
Invaluable to the industry. And so many artists are only using one or the other because of some of the misinformation put out there.
Right. And again, it's this is advanced stuff, by the way. This is like, advanced
Is it advanced?
learning. It is. I still haven't mastered. In fact, the first time I reached out to you was years ago. I was guest on Dr. Radio.
Yeah,
right?
I remember
right?
that.
Dr. Doris Day shows, Sirius XM 110. And I was so paranoid. I'm like, what if somebody calls in a caller? I was a PMU expert on the show. What if somebody calls in about organics and inorganics? It's so like, there's so much to know. And I'm like, Taryn, you don't know me, but please, you wrote this dissertation. I still have it. I need to look it up.
Oh God, I can't imagine what I wrote.
Everything that you talked about now and more, it was like a mini one-on-one lesson. You didn't even know who I was. And I felt so empowered now knowing, if a caller, and of course nobody's going to call saying, hi, what's the difference between organic and inorganic? It wasn't that. But I have so much credibility, I have so much integrity rather for the industry that I wanted to be prepared for these callers,
For sure.
But so no, absolutely. That's an advanced conversation. And I love that you brought it up because who's ever listening that agrees with me needs to sort of learn more.
Yeah, needs
about
to learn.
That. Yeah.
For sure.
Including me.
Well, it just empowers the artists. The more artists know and understand about pigments, about skin, about the better artists they're going to become, the better choices they're going to make.
Right.
Their healed results become much more predictable. The long-term aging results become much more stable.
It's so
for the
empowering.
client.
Oh gosh.
Yeah, and all this is stuff.
There's nothing that you can't do.